quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action, I'm ready to go. I'm never gonna get...
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everybody, and good morning, Harry. That melodious voice you hear is of our station manager, Harry at WNHH 103.5 FM on the low power station. But we're at low power really just pertains to the federal communications category. But due to the internet and due to Paul Bass's vision, we're able to kind of really broadcast worldwide. And today's topic is a worldwide topic. We're going to focus, but this first 25 minutes, we're going to focus on the Ministerial Health Alliance, the Ministerial Health Fellowship. Robin, you have so many names. I'm not sure how many, what your new name may be, but Robin and her crew and her passion, the Reverend Robin Anderson. But we're going to chat about the Ministerial Health Alliance, Ministerial Health Fellowship, and Robin's going to introduce that. And then some of the folks that are working with her, that are, and I won't say working, but I want to use the word collaborating, joining hands, spreading the good news, and the good news in a practical sense. Moral uplift is really great, but reaching people face to face, eyeball to eyeball, and sharing their concerns, but particularly it's going to be pertaining to this COVID pandemic, this public health pandemic. So Robin, let's kick us off. Share with people a little bit about the whatever title you want to use, the Robin's Incorporation or the Ministerial Health Fellowship, or just your ministry, but particularly there's this initial endeavor that you're funded to provide. So welcome.
Thank you so much, Tom. Thank you for having us on the show on today. The Ministerial Health Fellowship Advocacy Coalition is the name of the organization.
Excellent. All right.
And the Ministerial Health Fellowship is made up of pastors and also church leaders, community organizations in the Middletown, New Britain, Hartford, and throughout the state. It started with in the Meriden area, and then also we branched out to New Haven, Fairfield County. And so we are an organization that continues to advocate to address health disparities, as well as policy changes that need to happen that would continue to advance the care that is needed for persons of color and the rightful need for them to have the services that they so rightly deserve as being citizens of this United States, especially here in Connecticut. And so there's many projects that the Ministerial Health Fellowship works on. And so we have what we call the How Can We Help project, which is a project that works with persons who are in recovery. So we have recovery coaches that are on the ground. We also have a project that works with what we call our Trusted Messenger project, which is people of color, which is made up of various entities in the community, the NAACP, the Housing Department of Housing, and other organizations. And basically what we do is that we have put together materials that talk about COVID-19, also where you can get tested, the resources that are available, even about the vaccine, everything you need to know about the vaccine. And then also we have wellness kits that we distribute that has that educational information in there, as well as a thermometer to keep you safe, so to make sure you know what your temperature is, soap, PPEs, as well as sanitizer, and also a magnet that you can put on your refrigerator that continues to remind us that we are in a pandemic. And then we have these lovely people that are on today, which is our COVID-19 crisis counselors. And so that is a project that has been funded by way of DMIS through FEMA for persons who are in a pandemic. Usually FEMA supplies persons that are on the ground that would go and see how people are doing and faring in natural disasters. And so we also know that the pandemic is a natural disaster that has
Yes,
continued to
yes,
happen in our community. And so these COVID-19 crisis counselors are on the ground all over the state, working with faith-based organizations and churches, as well as we know that every faith-based organization is in a community. And so also working in the community, knocking on doors, giving information out, making sure that any community event that's actually going on, that they're working with them. And I'm going to let them share their
okay,
own.
all right. You want to let them get in a few words, Isabel?
Yeah, yes, I am. And so,
all right.
and so I just want to begin to, just wanted to kind of give you
No, that's good, right?
baseline
Yeah.
of what they do. So I'm going to ask Lori to talk about even today a short story that she has shared, but just to share about some of the work that her and Anna Hernandez together can do in the Fairfield County area. So I'll let them share and then I'll come back.
Excellent, excellent. Ladies, it's on you and welcome.
Hi, thank you, Tom, for having us. I Lori and Anna represent and service the Fairfield County area. We have our compassion for this position that we uphold is to service the people that are in need, that were affected by the pandemic in any means necessary. We try to aid them with resources such as rental assistance and utility assistance. During our past outreach, I have received numerous of text messages on follow-ups of people that we have aided with rental and utility assistance.
Yes.
And just hearing that we reach one individual, perhaps we can reach a family and then a community, especially in the faith-based community. There's needs that are necessary that a lot of people don't know about. And I believe that what we're doing is worthy. You know, it supports families in times of need, especially in times like this, and be able to outreach and cover a lot of grounds in the Fairfield County area has been a blessing to myself just to see someone else blessed. And
That's
I'll let
right.
my partner Anna follow up with that.
Hey, partner Anna, how you doing? Good morning.
Hi, good morning. We've been doing work in the community, in the faith-based community. We reach out to the Black and Brown churches, and we also reach out to the Latinx community. So because I speak Spanish, and now we have Brenda as well, and we reach out to them to see how they've been doing during the pandemic and just connect them to any resources that they may need. We've connected families to resources for childcare services. We've collaborated with all different kind of agencies in the community to create relationships so that when the people speak to us, we're able to give them a good resource and not send them to 211, which they say is very difficult to connect with someone through 211. So we've been that bridge. We've connected them to those resources and gotten them to actually speak to a person and not just an automated thing that they get the message with.
Amen. Amen.
Yeah.
All right. So I want to also have them really give you some stories about some of the people that they have encountered in the community. So I'm going to ask Monica if she would share some story of a particular person that she has worked with in the community. And Monica is from the New Britain area, New Britain, Waterbury, and Danbury, that whole corridor.
Excellent.
Good morning, everyone. Yes, we've had a great opportunity to do outreach in the community, and specifically, I had an opportunity, as we have already talked about some of the areas that we've helped people. Specifically, we are still seeing that people are struggling with respect to health inequity, insurance inequity, or deficiencies with respect to how they're able to address their medical needs. So specifically, I had an encounter with a gentleman who said, although he is getting insurance, Medicaid and or Anthem Advantage, he still struggles to pay for the exorbitant amount of the cost with respect to his medicines. So we are seeing that people, in spite of insurance, and we are grateful for the fight and the connections that Pastor Robin is making, to see that we are working more to get the services that these people need with respect to health insurance. So that is one of the stories that I can share, that people still need help with health insurance.
Thank you. And I'm going to ask Harmony and Shai, who work in the Middlesex County area, which also includes Meriden and Wallingford, in which every Tuesday, and we operate a faith-based clinic in which we offer each one of the vaccines. So people have a choice of what vaccine that they would like to have. And they are on the grounds and have been in the trenches, really making sure that people know that. And so every week we're really vaccinating sometimes 200 to 225 people a week. So I'm going to ask Harmony and Shai to share a story that they would like to share of what they've encountered.
Harmony and Shai, looking forward to hearing from you. We can hear you, man.
Hey, so I'll start first. So I know me and Harmony came across a gentleman before in the past. He had his employment hours cut due to the pandemic. So we were able to give him some resources that may help him and his family. He mentioned that he didn't have enough money for bills and food and to help take care of his kids as he did in the past. So we were able to tell him about the resources to help him get some food. We were able to provide, we were able to connect him with the resources for the food boxes and other financial needs.
Shai, tell me, when do you find, and this might sound like a sexist question, but do you find that some of the guys the males are a little reluctant to share their needs as much as the females are? I mean, we hear this about males.
Yes.
Talk about that a little bit, because the guys, we got to understand, man, this hard-headed thing, hard-head, soft. Well, I won't complete that that old comment, but talk about that a little bit.
It becomes like a pride thing for us guys, because we don't want to let people know that we're, kind of down a little bit or we need help. So, we kind of just try to figure it out on our own. So now me interviewing some gentlemen, them coming to me as men, it's like they get over their pride. And that's something hard for us men to do sometimes. So when they come and really get over their pride, things happen. That's it, really.
Excellent.
Thank you.
Was it Harmony you mentioned, Robin?
Yeah, I don't know where to leave off from that. He did so well. But yes, we are on the ground running full speed ahead. I'll give a quick, another very quick story that we've encountered. There was this woman that we also encountered who she was struggling very, very hard with depression and anxiety that she was telling, because she had lost her job, and then people in her family started to get COVID, and some of them even had to go into the hospital. So she was very, very anxious and very nervous. So one of the things that we were able to do, because we work in the clinic at the Middletown, the Cross Street Vaccination Clinic, I'm sorry.
Excellent.
We were able to inform her about the clinic, and she did actually get vaccinated, which helped ease her mind, as well as we gave her some resources for mental health, because that is another very big issue that's come up because of the pandemic. It's been an issue for as long as we can remember, realistically, but it's become way more prominent now. There's a lot of people who are too afraid to ask for help, for mental help. So it is very nice when we are actually able to help those people and show that we care and want only what's best for them. And hearing that they definitely, it was one of my favorite stories, because she got help, and then she in fact ended up, when some of her family members got out of the hospital, they ended up getting vaccinated. So it was a very, very good story.
Thank you, Harmony. And I want to also at this point go to Brenda, who Brenda is our person that she works all over the state, and mainly working with Latinx churches as well as the community. And I want her to tell a story about even her with a pastor who had some hesitancy and how he ended up getting vaccinated as well.
Yeah, so hi. So I remember back in March, I actually did a presentation at a church here in New Britain, And the pastor of the church actually was a little hesitant about the vaccine. I found out later on they had a lot of questions. I went with Monica, and it was like an hour of just talking to them and having questions from them. And on May 1st, they actually ended up hosting their first vaccine clinic at the church. Pastor vaccinated, and everyone at the church that could get vaccinated that day was able to get it.
So I just wanted to highlight, Tom, so everyone would know how it doesn't matter who they are, that, we talk about a hesitancy problem, but a lot of it is just needing more information, being able to have a one-on-one conversation, and then making their decision about getting vaccinated. And so that is some of the work that the COVID-19 crisis are doing. They're on the ground having these one-on-one conversations. So I'm going to go to Sylvia to New Haven, and she can kind of share with you. I know she's been on the show, her and Germano both, but just share with you also a story.
Excellent. Sylvia, good morning. Ms. Cooper, are you there? Oh, her face.
I was on mute. I'm sorry.
That's
How
okay,
you doing,
Jim.
Tom?
That's all right.
Good to
I can
see
give
you.
good to see you. Good to see
Good to see you.
It-
So
it
I want
brought
to
the
talk. I
Go
want
ahead.
to talk about how this program has really helped us shape and mold partnerships with other organizations. Germano and I cover the Greater New Haven area. We've been afforded the opportunity to partner with the Cornell Scott Health Center and reaching those hard targeted populations and communities with Black and Brown people, so that we can have conversations with them in a platform such as yours, and then go out and do vaccinations and really hit the streets with all the persons. We just had a presentation with the Job Corps Center last night, where we had Dr. Brown from the Hill Health Center talk about the ingredients in the vaccine, talk about, those questions that are tough, the myths that exist out there, to ease the minds and move more people to hesitancy to confidence. And then Germano and I are able to, in those settings, talk about the work that we do, and we go in as a team. The doctors do what they need to do. The other folks, Maurice Williams, of course, you know him from YCCI, talk about his experience in clinical trials. And then Germano and I are able to go in, assess folks and have encounters, and then find out what their needs are. And all my coworkers here have stated rental assisted utilities. I think Harmony really honed in on emotional support. Yes. This pandemic has really taken a toll on folks being isolated, disconnected from loved ones, and just seeing death all around you. It's COVID, but also not properly being able to mourn your loved ones during an isolation. So what we're doing is just providing comfort measures and conversation, and really telling folks, it's okay to see someone. And then also too, folks who are not connected to a healthcare provider, given an opportunity, says, you know what, I need a primary care physician, because it's good to have a conversation with your doctor who knows you, to talk about those hesitancy issues. So that's what we've been doing, along with the other work in New Haven.
Yes, and that's been one of the things of making really great partnerships, as they talk about Hill Health. We also have Anthem Blue Cross, who has also been partnering with us and coming to the vaccination clinics and being able to talk to people about healthcare, and making sure that people have healthcare. And that is one of the issues that also happened. You remember early on that many people don't have, Black and Brown people don't have primary care doctors. And part of the hesitancy is that they don't trust, they don't trust the medical system. So, it's hard for them to take themselves to the doctor and to find out what's going on. So a part of the project is to really help people also to make sure that they get connected to those things that will help them to remain healthy. So I'm going to move now to Hartford. We have our Hartford crisis counselors who are doing a wonderful job and partnering with Trinity Health as well. So Akila and also Yvette from Hartford, the Hartford area.
Hello. Thank you for having us, Tom, on the show. I just want to, piggyback on what everyone has said, just building these collaborations with, community partnering agencies. Myself and my partner, Miss Yvette, we've connected going to the Park and Memorial Vaccination Clinic, and we were able to connect with Trinity Health, like Reverend Anderson said, and possibly set up some booths so we can give out this encouraging information about the COVID-19 vaccination. So like Sylvia said, we can move away from the hesitancy and move towards confidence and letting people really feel safe in their community. Seeing folks like us, you know, within the community, the Black and Brown Latinx, seeing us and just feeling really comfortable sharing their stories. I know last Friday, we were at a vaccination clinic in Hartford on Barber Street, and Miss Yvette, she can finish the story. She really helped some people get vaccinated.
Yes. Miss Yvette.
Yes, good morning, Tom.
Good morning.
Yes, me and Akila, we have been on the ground doing a lot of outreach. And one of the locations we were at in Hartford was on Barber Street, and Trinity Health was there along with FEMA. So there's a lot of activity that go on kind of in Hartford location on the north end. So I realized that a lot of people are there and they're not being actually vaccinated. So I did have the opportunity to speak with several people and also to educate them the importance of being vaccinated. So I was successful by sharing information of COVID-19 and how important it is. So 3 people did get vaccinated on Friday. So that was a win-win situation for them, as well as, you know, let you know that your work is not in vain.
And Yvette, how are you able to approach them? I mean, I'm sensing that the 3 that you're referencing were hesitant. What was your approach to kind of opening the door or getting their attention?
Basically, you know, things are changing, things are shifting as far as COVID-19. The CDC is opening up some things, and I realize that it's a lot of people out here that's still unvaccinated, and we're around our family, our friends, and people are a little bit more active now. Now it's getting warmer, and COVID-19 has not went anywhere, you know. So just giving them something to think about, because a lot of people are actually systematic and they're actually carrying it home to their loved ones, and people are still dying every single day. So it just, you know, gives you a thought to think, you know what, I really need to protect myself as well as my family, you know.
Excellent.
I think also too, one of the encounters that I had with a young lady, and she came with 2 of her friends, and also her son, her 9-year-old son. And so she was really, you know, thinking about it, but wasn't sure. So we had a conversation, and her son actually said to her, "Mom, please get vaccinated, because you could give it to me, or you could give it to grandma and she might die. And so please get vaccinated." And that was her deciding factor, her 9-year-old son. That,
9 years old.
that 9 years old, and said that. And so she said, you know, yes, I'm going to get vaccinated. And so, you know, a lot of persons that also, I had another person that was 17 years old, who grandmother, he contracted COVID, and then his grandmother contracted it, but she actually died. And unfortunately, you know, that situation also really convinced the other members of the family to get vaccinated, a death that, you know, actually occurred. And so even the fact of even letting him know that it wasn't really just his fault, because he was struggling with, you know, feeling like it was his fault that his grandmother died, but it was a call for the family to all get vaccinated. So those are some of the great stories that we have. And just wanted to also say, Robin Ross is also on, and she's one of our recovery coaches. So she works also in the trenches. And so I don't know if she wanted to say something today.
Robin, this is a very informal kind of conversation, although we are going worldwide. So I'd love to hear from you, because the recovery issue is so important. I mean, all of us, in my mind, Robin, are recovering from something. We just don't recognize what it is. We don't recognize what our addictions and problems happen to be. So Robin, please, if you're willing to share, that would be great.
I know that Robin Ross is heading over to Yale. She wasn't feeling well yesterday.
Oh, okay.
Okay, so maybe,
mention
maybe she's not able to speak on today. But I'll just say that, you know, a part of the work that she's doing, of course, we know that during this pandemic, there's been a lot more overdoses also, and, you know, persons that have relapsed. And so she's been inundated with working with persons that, you know, are struggling, really struggling, you know, to, you know, with their sobriety. Those that have been clean for many years, but because of isolation and because of separation from family members and friends and things. And so she has been, has her hands full and continuing to do some great work in terms of really engaging people and also really helping them get into treatment, but not only just being there for them, but also being there for their families as well. So, you know, again, the work continues to go forth, and we have time, believe it or not, we started this project back in October. And I was looking at our statistics, and we have reached close to 5,000 people in the community by being in the trenches and on the ground, and also have saved many people from, you know, making sure that they get food, making sure that even during the time helping their kids, you know, have them get access to Wi-Fi so that their kids are able to get online, to helping people get prescription medication. You know, so we have been continuing to do the work. Unfortunately, the funding will end June 24th, and we're continuing to be on pins and needles because there's so many people that are out there that we have not touched. That we
Robin, what has to happen for us to be able to have your life extended beyond June 24th?
What has to happen is that we receive some funding to continue, because we know that we're still in the pandemic, and that we're nowhere near out of the pandemic. We're not even in the post-pandemic phase. And so, and we still have lots of people, especially Black and brown people in the community, who are not vaccinated. And we really are hoping and praying that funds will come forth, because we want our people to live and not die. And it requires us, you can have seminars, you can have webinars, you can have town hall meetings, but the one-on-one conversations and being out in the trenches of the community and talking to people that look like them is really, we already have seen that it makes a difference, and it's continuing to make a difference. So it is our prayer that we will be able to extend this program and continue to go forth.
I mean, Robin, is there, if someone listens to the show, and a lot of people do listen to the show, we send a link out profusely to a variety of folks. Is there somebody they should call? Should they call the governor? Should they call the DPH? I mean, should they call FEMA? Should they call?
They should call FEMA. They should call DPH, and also even you know, call the governor's office, and mainly the governor's office.
State rep or state senator.
Yeah, state representatives. You know, House representatives, senators, everyone, because this project is really needed, and it's really making a difference in the Black and brown community.
And so when they do that, they should reference that they're calling to support what again?
They're calling to support and asking that the funding be extended for the crisis, the COACH program, the COVID-19 crisis count.
And I think this is so important. I mean, obviously, if anyone's watched the show over the last 5 years, almost 90% of the time I'll have nonprofits on the show. And it seems like, why you're always promoting these nonprofits, because these are the people doing the work. I have my bias. These are the folks doing the work. And this is nothing to say, Robin, against United Way, or you mentioned Trinity Health or Yale or other people, but we don't have, this is a war. And when you have a war, we need as many troops on the ground as needed. And we can see that we still have triage. We can see that people are still dying. So this is not duplicating your initiative and your crew. We're not duplicating or stealing jobs from anybody else. No, we're fighting this fight, and everybody has to be involved. And there's enough money to go around. So I hope people will hear the show this morning and do call for extension. I know everybody on the call, I can't speak for them, but I'm going to speak for them. I know even if funding does not come around, they're going to still be committed to their particular ministry. I know that, just I guess got this sense of hearing what they're saying. So wherever they're going to be working, but we want them to continue to be kind of related to you, because we need this unity. We need this unity. And
yes, we do. Yes, we do. And I think that also, I'm also a culture ambassador also for Yale as well. And I work with Tisha Johnson and Rev. Dr. Perry and Clayton and all of those at Yale. And so one of the things that we continue to know the importance of doing community work, but also engaging people. And that's why it was also you know, we were able to really, not only were they trained on COVID-19 with a curriculum that we developed, and also about the vaccines, but also they have also been able to engage people in understanding clinical trials as well. So again, this is some work that will continue to save the lives of our people. And so this is why this is so important.
Excellent. ladies and gentlemen, as I say, Robert, we're going to have you back and invite some of your crew back, and we'll tell Germano to guess we'll work around Germano's schedule next time so we can fit him in. And I just want to thank all of you for being with us, and Robin in particular, just keeping the fight. Robin, close us out with you mentioned the 9-year-old and teenager. There's something in the Bible about letting the children provide vision for us old heads.
Oh yeah, it says, let the children come unto us, let them suffer unto us, let them come, into the kingdom. And so Jesus was always very, very open and wanted the children to come, because the children were not only precious to him, but children also are very gifted also, and they have gifts just like we do. And they are also very innocent. And so it says that we won't even get into the kingdom unless we have a childlike spirit. So we thank God for that 9-year-old who also had wisdom, enough wisdom to speak to his mother about her getting the vaccine, not just for herself, but it would save the life of the whole entire family. Indeed. And so that's the way we have to think, that me getting the vaccine is not just for me, but it's for my whole entire family. It's for my community that I live in. And that we are in this thing together, that we are in all that we're dealing with, especially with racism and all of that, that we need to do everything we can as people of color to live and to not die, and to continue to be in the movement of making sure that we are healthy in our mind, in our body, and in our spirit.
Amen. Amen. Thank you, everyone. Reverend Bonita Grubbs is going to pick up that torch and carry on, and we'll have a little dialogue. And as I say, I know she's waiting in the wings, and I see her lovely face now on the screen.
It's so good to see her.
Hi, Bonita.
Yes, indeed, even from a distance,
so
separated physically, but still spiritually.
So we're going to go to Bonita. We're going to go to Bonita. You can sign off. You can listen. It's up to you. This is a crowdsourcing endeavor. This is sharing the wealth. So if you have to go, understand. If you want to listen to Bonita, we're good. That's fine too. Reverend Grubbs, how are you doing?
Doing the best I can under the circumstances.
Amen. And those circumstances sometimes change, but you still continue to be to not drown and still surf. I'm gonna call you the surfer. Call you one of the surfers. I had the pleasure of transitioning to Reverend Bonita Grubbs of Christian Community Action. And Bonita, I couldn't recall when we exactly met, but it's been 20 or 30 years ago. So you've observed me over this turf of New Haven and Connecticut, and I've observed you. And it's been an observation in a good way. We have about 20 minutes, and we talked about 2 or 3 things you might want to chat about. And I just want to say that even if your mind has changed since you last made a decision what you want to talk about, that's fine, because when I reflect upon some of your presentations at the various Christian churches, at synagogues, at mosques, when I've seen you at Hartford, the state capitol, when I've seen you at no longer 500 Blake, maybe 15 to 20 years ago, talking about about health, maybe 25 years ago. And if I said fighting back, quite frankly, Bonita, maybe one person might know what fighting back means. And if I said Empower New Haven, maybe 2 people might know what Empower New Haven means. So things come and go, but you've been in the trenches, in the vineyard, and still saying healthy, well, and inspiring people for a few decades. So I don't want to put words in your mouth in any way, and just want to open it up for discussion of what's on your heart, mind, and soul at this point on May 14th, a Friday.
Well, first of all, Tom, thank you for the invitation to be able to share some words. I think most of the work that I have done has been person-centered at CCA. We start at the level of what people have need for in terms of emergencies, the basics, whether it's food, clothing, shelter, energy assistance, diapers, those kinds of things are at the center of our mission. And that's the help part of our mission. We also have the housing programs, and I'm soon to be able to make an announcement about the return of our former transitional housing program. But we have been offering emergency housing for families, and up to a couple of years ago, transitional housing. And again, there'll be more to say about that later. But the other part of our mission is really about hope. And it's really in two different directions. One is trying to work with and be involved with individuals in such a way that they can see beyond their circumstances. Be able to know that just because they're in an emergency situation, that doesn't mean that they have to remain in that situation. That there is the opportunity, there's a better day coming, as I used to hear at church a lot. And all of our help, all of our needs, all of our help. God, our help in ages past, our hope for years to come, a shelter in the time of storm, and our eternal home. And so the basics for us is really about trying to provide a sense of hope for those who are in difficult circumstances. And in that regard, we've had a lot of work, or we've done a lot of work, I should say, around advocacy. Because what we understand is that things don't happen just because a person is in a difficult situation. It's sometimes the systems don't allow for individuals to deal with their circumstances and to get to that better station in life. We stand on the shoulders of lots of people. We don't we don't go through this life without having received some help and given some hope. And so the idea of advocacy, or the idea of a helping hand, or the idea of support and challenging systems that perpetuate poverty and injustice, really a central part of what it is that we've tried to do in our 54 years of existence in CCA, and will continue to endeavor to do.
But Benita, unpack a little bit more, if you would, about because we're hearing this term systemic racism and racism as a public health crisis. It's become almost like a slang term. People just spit it out of their mouth so easily, and I'm not sure whether it's trying to sugarcoat and divert us from the hard work. And I don't want to put words in your mouth in any way, but you referenced the external environment and sometimes its negative impact on people of color.
Well, we don't live in a society that where there's a level playing field. There are some individuals, because of their income, because of their gender, because of their race, because of their wealth from a different generational perspective, who have had advantages, and many individuals of color have not had the advantages. And I think that there's a part of that that allows for us to think, well, how can we increase the level of advantage? How can we create and increase the level of opportunity? What's the structural way in which we can actually make those kinds of changes so that everyone does have equal opportunity? Maybe not equal distance or equal outcomes, but certainly equal opportunity, because some of that relies on what we do in order to make sure that we take advantage of the opportunities present themselves. So I think that we have to look at both what the individual will do, as well as what the system will allow, and the opportunities that there are to make changes, or at least to advocate for changes, so that those doors can be open in a way that sometimes they are not.
So maybe let's jump a little bit to the advocacy thing. I mean, people may or may not know, but there's something. If I said the word "Mothers for Justice," they may not know that you're the eve of mother. You were the eve, one of the seminal forces for Mothers of Justice, and in terms of advocacy, in terms of the state capitol. So, are there any bills pending, or Medicare for all, or any issues that, from an advocacy standpoint, that are still near and dear to your heart?
Well, the group is now called Mothers and Others for Justice.
Mothers and Others. All right,
there's
there's room
an
for me.
opportunity
Okay.
for other individuals than just mothers to be able to participate and support that work. And there's certainly been a lot of attention paid by the members of that group to what kinds of things that they want to advocate for, and the ways in which they want to engage with those systems. Some of it's around issues of diversity and inclusion, but really it's about what their experiences are and how they can really create the opportunity to be heard, and to make sure that they're heard. We also have a health group, because health equity is talked about a lot these days, and that access is really, in both of those cases, whether it's Mothers and Others for Justice or the health group, is really about what that's designed to do. And data are one thing, and providing information about the current state of things is one thing, but there's nothing more powerful than a personal testimony.
Mm.
Some of us who have been in church during our lives know something about the power
Mm.
of testimony
Mm.
and how electric that can be to inspire people to take that next step. And so you got to have the data as well, and to be able to strengthen the advocacy that I think is so important, particularly.
And what's kept, Benita, what's kept Christian Community Action from going out of business? What's prevented you from fulfilling your mission, from saying that you can now rest and enjoy going to watch the WNBA? Well, what's kept Christian Community Action from being able to just close the doors?
I think it's really the fact that there's a need, and the need is consistent. I think that the way that we provide services, it is really holistic. So it's not just one thing. It's, you know, looking at a family, looking at the children in the family, looking at the person-centered approach, and really trying to take the family as a unit, and to be able to say, these are the things that you need. Now let's see what else we can do. I'll give you an example. We do have those emergency services, but a couple of years ago, we started something that's called the Arise Center. And it's short for Accessing Resources for Independence, Skill Building, and Employment. And what's the central letter in that word? I. And what does it stand for? Independent. Not that any of us is absolutely, completely independent, but you strive for that upward look, that upward glance, that upward movement to be able to increase the level of stability, economic security, you know, housing, and life. And so that particular program is really the next horizon, because you can provide food for individuals through your food pantry, you can provide diapers through a diaper bank, you can provide energy assistance as that is, but that doesn't allow for that next step to come. And the next step is really, you know, having an individual to really participate in, be engaged in a process of reaching that, and them dreaming about what it means to be independent more so than what they were before. So that's really the next level of work that we want to do, because what we know is that the way that individuals move from instability to stability is one by their own desire, but also the supports and the integration of those supports, so that families are actually able to get to that place that all of us want to, based on income, yes, at some level, but based on self-respect and self-regard, and feeling as if there's a sense of equality, or at least opportunity that they've been able to take advantage of. And, you know, and I personally know that had it not been for a couple of teachers who pushed me, that I wouldn't be where it was that I was. So that compassionate influence and pushing makes all of the difference in the world, from a trusted person. And I think that's what staff members do with CCA each and every day. They're not all sugarcoating, they're pushing individuals and having conversation with individuals in such a way that there is that upward movement, that forward look, rather than just needing to stay in the circumstance that they'll get a bag of food and then go home. Now, there are other questions that the staff members ask.
And you know, Benita, just when you reference your staff, let's give a little shout out to some of your staff members. I'm not sure if you have your staff list in front of you, but mention their names and some of the responsibilities that they have, and why they kind of indulge and are able to tolerate you from 9 to 5, Monday to Friday.
Tolerate. Thank you, Tom.
Well, you know, love. Okay, I'm sorry. Tolerate. I meant to say love. How they show the love to you. I'm sorry, every day. But I know Myra's over there, and who else is over there these days?
Wina, Shawnette, Margaret, Meryl, all of the staff in other ways. Nicole, building supers, the director of development, Diane, director of programs, Sean. All of us are working together, as they say, for good. And it's a joy to be able to have folks who are as dedicated as they are to work.
You hear people often talk about equity and equality, and sometimes the words are synonymous. Sometimes they're even contradictory. Any thoughts about that? About your feelings when you hear the word equity and you hear the word equality?
Well, I had an opportunity to, I don't know, take a sidestep electronically, and I saw a chart. And equity recognizes that some people are at, well, that people are at different levels. And that little diagram that I saw, it was kind of a stepping stone. So one person was at one level, and then another person was at another level, and another person was at a third level. And that presumes that there is indeed, yes, an inequality, but that presumes that we are at different starting. Equality, according to that chart that I saw, had everyone at the same level, and we're not. Politically, socially, governmentally, we're not at the same level. We come from different circumstances. And so my question is always, if that's the way that equity kind of starts, then that means that we need to look at who is at the lower ebb and how do we work to bring that person or that family to a place where they are not always at the bottom, or they're not always in distress, or they're not always in crisis. And so the effort is not in terms of talk. It's a strategic and specific and programmatic and social and societal and governmental and financial effort that's always important to be able to take those kinds of situations and the individuals in those situations so that they can become the persons that they wish to be.
Indeed. Let's jump in. The only reason I'm jumping from topic to topic as quickly as I can, because we have only about 12 more minutes, but it's been a while since I've had a chance to see you in person, and definitely a while. This is, I think, our first time on Zoom. But talk about COVID. As you know, we talked for the first 25 minutes or so in terms of the impact of this pandemic on our psyche, on our soul, on our household, on our spirits. How's that kind of impacted you and your mission? And what's your prediction about move as we come out of this? Are people still going to be damaged? Do you think we can kind of find a resurrection moment, a rejoicing moment, or are we still going to be kind of slogging along?
Well, at least at CCA, I'll say that we have remained open, but closed in some ways. Kinds of interactions that we've had with the individuals we serve has had to change, and that's part of the challenge that we face, because it's always better to be able to have a conversation with people face to face, or at least in person, as opposed to through Zoom or through a door. But we have made changes, we've adapted to the environment for safety purposes, and the services indeed do continue.
Well, I missed this last Thanksgiving. You did the Thanksgiving drive for the turkeys in the bowl for 15
Yes, we did.
Years?
Yeah, we did. That happened last year. Yes, we did. We did social distancing and trying to make sure that individuals were kept 6 feet away. So we made some changes, but the service did indeed continue last year, and it will continue this year.
Is it since you'll have a fall fundraiser again? Because again, your events at the Schubert, and there's a new director at the Schubert. I mean, those are always high points on my social calendar. Your fundraiser.
No, we didn't do that. We haven't done that in a few years, and we wouldn't have done that this year because of COVID. What we had to do was to practice good public health and social distancing. So we didn't do those kinds of public events.
Are you planning once things get opened up?
Not at this point, because our hope is that our former program will be opening. So that's the only public event that we will be organizing.
So let's go back to Arise for the next 2 or 3 minutes, because that's key in terms of the integration of services, the structural support, the financial support, et cetera. So I remember there was a presentation that you gave at the Community Foundation about maybe 5 years ago, kind of the birth. It was a few schematics that you put on the slideshow there. So let's kind of review in people's mind what to look forward to in terms of the continued manifestation of substantive increase of the Arise vision?
Well, I'll start by saying CCA has been in the Hill section of New Haven for all of its time of operation. The former Stepping Stone program is in New Hallville, and so there was a neighborhood change, if you will, as a result of the building being available. What I know otherwise is that because we have been in the Hill for all of our, that we've had a specific focus on trying to provide those services to people in need, starting with shelter and then branching out beyond that. But what we know is that poverty is just not restricted to the areas of emergency food and of shelter, that there are other considerations to be made. And so our hope is to be able to take the independence theme, broaden it so that it can be a community type activity, not the same as a community action agency, as much as Amos Smith and the folks at Community Action do. The work that they do is quite wonderful and I think quite needed. And they've been in the community for a long time as well. But they do good work. And so, what we want to be able to offer services that the Community Action Agency and some others do not, but to really develop a relationship with people in the neighborhood of the Hill section so that they can get access to employment training, child and family services, and other kinds of opportunities that are pointing towards building of skills.
Excellent, excellent. Reverend Anderson, since you've been kind enough to stay on the call, and since I want to kind of end it, if we could end, Bonita, with kind of a sister-to-sister moment. I mean, we have ladies in the clergy. You guys have said prayers to yourselves and to your other sisters that the guys will never hear about. I don't want to put words in your mouth, but I guess I was thinking, Reverend Anderson, if you'd like to share some comments or to Bonita, they could be inspirational, they could be just supportive, but the sister archetype, the female archetype, is pretty powerful. Not to get too philosophical, but nonetheless, yes, I think if we wanted to kind of close out with kind of any sister comments between the two reverends. You're on mute, Reverend Anderson. Reverend Anderson, you're on.
I just want to say to you, I thank God for you. I thank God for the ministry. I thank God for your vision. And I thank God for the work and your leadership that you have continued to provide for many, many years, and the people's lives that you have touched is just phenomenal. And you continue, I can hear it in your voice, you're continuing to look, I can see the vision, I can see the movement in your thoughts about what's next. What are some of the things that need to go forth next? And so I just want to say to you, please keep doing what you're doing, keep doing the work that you're doing. I know even if you retire tomorrow, you're still going to be working and still continuing to advance the kingdom of God. So continue to go forth, and you know that I am right here with you. Anything that I'm side by side, I'm praying with you in any way that we can partner together, work together, which we have done that in the past and will continue to do. You know I am right here, and I've learned a lot from you, and I thank God for you.
And Sylvia, I see you're anxious to jump in as well. We're giving her not roses. We can't even give her a dandelion right now, but we want to show her the love through Zoom.
Well, I'm no stranger to Bonita. I've worked for her for many, many years and learned so much through advocacy, through case management, as well as volunteering with the thing. They're my family. I mean, that's my family at CCA. And so it's a true testament to what the work done. I saw the baby Arise come to path, and there's so much work that they do beyond the Hill section in the greater New Haven area. And her vision is just amazing. And that's my family over at CCA. So there's nothing that they don't, when they say they're going to do something, they're going to do it. And the advocacy part, we've made documentaries, been at the Capitol with breadcrumbs and all kinds of stuff. And I continue to be with Merle in presentation. So I am just excited for what's to come. And I believe that CCA is just beginning. So just wanted to say that.
Amen. So the rebirth is important. Harry, the station manager, will play the music until we go. And I always kind of push the envelope. So we're going to keep talking until he plays the music. Once he plays the music, we're out of here. But I want to pull in, Keely, you've been, just from reading, looking at your face. I mean, any thoughts in your mind about what you heard either this morning, the first segment or the second segment?
I'm really grateful to be on this morning. I'm just really grateful that Reverend Anderson has, put us on this platform to hear these wonderful, beautiful messages of hope and resilience in our community. And I just know that there's hope for us, for us to come together as a community and for us to be strong as women, as men, and just come together as a family. I'm just really grateful to be here. And I piggyback on everything and ditto everything Sylvia, Reverend Anderson, and Reverend Grubbs has said. And I'm just privileged, honestly. Thank you.
Privileged for me to kind of witness all of you. And Reverend Grubbs, take us out with maybe a parting comment for 30 seconds or so, or a parting thought for.
So I'm just, this is my end. Let me find the one that I want to find. Just give me a minute.
And Harry, give it.
I don't have, yeah. So as Robin was talking, it made me think about a verse of scripture. It's one of those things that happen when you're a minister.
Yeah.
And people who are Bible students, Bible scholars. The John 10:10 says, the thief comes to steal and kill and destroy. But I came that they may have life and have it abundant. That's what we ought to be about. Trying to give that opportunity to individuals so that they know what abundance looks like and that poverty is not a condition that should be permanent ever.
Amen.
Amen.
Well,
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up.